How the genicular artery embolization comes in the picture. It inhibits the angiogenesis, it embolizes the angiogenesis and reduce the blood flow and reduce the edema to the synovium. So we reduce the synovitis and thus prevent more structural damage. So you are stopping the pain cycle, stopping the inflammatory cycle at that point. Uh, Multiple papers in the Rheumat journal supporting this and supporting the thesis of issue of pain due to angiogenesis and, and that is causing pain in osteoarthritis. So osteoarthritis is just a disease of cartilage, is not a right thing. It involves every compartment of the joint, right from the synovium and the menisci and the ligaments. So there are multiple papers now, and meniscus, ligament, tendon and fat pad have abundant sensory innervation, and this is also a source of pain. Then there is a theory of DNA methylation, histone modifications and mRNA. This is called epigenetic regulation of osteoarthritis. And we know apoptosis, then there is ferroptosis and pyroptosis. So this is all about epigenetic regulation from the Rheumat papers, and so cause of osteoarthritis from wear and tear has changed up to DNA methylation, histone modification, local cytokines, storms, releases of proteases and destruction of tissues. So after a big damage from OA, we embolize the arteries, angiogenesis stops and thus inflammation. Embolization, we saw about the etiology, now about the papers about embolization. This is the paper which shows a embolization in which we embolize the blush. There is like a typical tumor blush we see in the giant cell tumors. We embolize the blush which is seen in all the arteries, and no recurrences during follow-up at 16 to 48 months, and 2 patients had a transient cutaneous ischemia that the previous speaker told, but they go away in 2 to 4 weeks, so it is a safe procedure. Multiple papers, again the paper by Dr. Yuji Okuno, and this is very helpful for mild to moderate osteoarthritis, and it rapidly relieves resistant pain and restored knee function. So resistant pain meaning pain resistant to the NSAIDs and pain resistant to the physiotherapy. There is significant reduction in the WOMAC score and VAS scores after embolization. It is this paper showed it is also helpful for severe osteoarthritis. So my personal experience is we have done many patients of severe osteoarthritis, patients age more than 75, 80 with valve replaced and multiple comorbidities, and even in this type of patients we see more than 50% pain relief, and this is sustained pain relief at 1 year. Another paper showing efficacy sustained at 2 years. So this is a very good number compared to the genicular nerve ablation and other modalities, injection of PRPs, injection of BMAC, that is bone marrow cell aspirate. This gives a long-term, comparatively long-term pain relief than the other temporary interventions. Mid-term clinical outcomes and MR imaging changes. So this shows the MR imaging changes after embolization, and this has significantly improved pain symptoms and clinical function. Even the synovitis component gets reduced after embolization, and so we know that inflammation is objectively also there is reduction in the inflammation. Another paper, 40 patients, 47% of the patient had more than 50% reduction in WOMAC score. So it's a sustained pain relief up to 2 years, that is known now. Again WOMAC score and pain VAS score reduced by 61 and 67% at 12 months from the baseline, and this is in patients with moderate or severe osteoarthritis. So we can also offer in selected group of patients genicular artery embolization for severe osteoarthritis. In grade 4 also we can offer in selected patients. This is systemic review. So this review has shown that if the pain is more, the effect is more. So if the VAS score is 9, 8 rather than 6, then the pain relief is better because the inflammation would be more and the embolization would be effective. So this paper showed, this was the 2024 paper, apart from genicular artery embolization, and other musculoskeletal conditions also like plantar fasciitis, tennis elbow, shoulder conditions we can use. This is a paper in 2025, moderate to severe osteoarthritis, and microspheres average dose higher than 2 ml is also safe and effective. So gradually there is a shift from temporary embolic agents to a permanent embolic agent. I have also shifted from imipenem to embosphere because the sustained pain relief is better with a permanent embolic agent. But yes, we have to be sure that we are not embolizing the collaterals and not damaging the skin. Significant pain relief by genicular artery embolization. Here in this paper, there is significant reduction in vascular angiogenetic factors, growth factors, and IL-1RA levels. So this is a blood markers where they have shown that the inflammatory agents have also reduced after embolization, thus contributing to the local pain relief. So this type of biomarkers decrease NGF levels after genicular artery embolization is seen, and this contributes to slowing of cartilage damage after embolization. MR imaging after embolization, pre-procedural synovial contrast enhancement has reduced after embolization, and this is also an objective paper. This paper has shown that they have injected stem cells after for embolization. It is safe, and the durability we don't know because this is just a single paper, and they have injected 70 million stem cells per injection and in each artery. So they have injected in medial arteries only, and this is just a single paper, so we not sure about the safety. Can we do genicular artery embolization after total knee replacement? Yes. We don't have to worry about the bone infarcts. We can embolize safely, and there is good pain relief after embolization. Can the orthopedics would ask whether any change in the surgery after genicular artery embolization? No, they can do the surgery in the same way. We have many patients who are clinical failure of genicular artery embolization. They have underwent TKR and no issues after TKR. So the previous speaker has already talked about this. This is just the anatomy, and this is KL scoring, where in grade 3 and 2 we do generally genicular artery embolization, but as I mentioned previously, in grade 4 also we can do in selected cases, but we should not do grade 4 embolization in 60 years, but in 70, 80, 90 years it can be done. WOMAC scoring, just take the grams, super selectively cannulate, see for the blush. I generally look in all the arteries. This is the descending. Post-embolization. Imipenem was injected in this patient, so no need to worry about the non-target embolization. As I mentioned, we go in each and every artery, superior, supromedial. I'll just rush through the slides. We have to take care when we are using embospheres or embosphin, 100 to 300 microns, and check. We can take the help of ice packs and prevent non-target embolization. Nexasphere is the new drug that is absorbable microsphere. It is available in India but costlier than embosphere. Rheumatoid arthritis patient, 30-year-old male, not responding to medical management. You can see the blush is as good as the giant cell tumor embolization that we do. So we embolized all the arteries. This patient had good pain relief. This is the intromedial. Supromedial genicular artery. Post TKR, because of the artifacts, we have to take lateral views, oblique views. It becomes tricky sometimes, but you can generally cannulate each and every artery and embolize them with permanent embolic agent, and there is good pain relief. This is the lateral artery and the infromedial. This is the infromedial genicular artery. This is the infralateral genicular artery. So there is paper regarding the post-arthroplasty knee pain, and the KOS score is also reduced, and VAS score also gets reduced after embolization. This is a triple blind study in 2023, single center RCT. So we have now ample papers supporting genicular artery embolization, 2 years trial, and various things in our armamentarium, various agents to embolize. Now even lipiodol is used sometimes for embolization.
Last 2 minutes.
For stem cells are used, and enough experience now. I am doing genicular artery embolization since 2020, and we used to use exclusively imipenem. Now we are shifted to embospheres, and the redo procedures and complaints of the patients have reduced significantly after changing to the permanent embolizing agents. Thank you.
Thank you, Dr. Rosil, to breeze us through a lot of papers and evidence. Next talk is by Dr. Karthikeyan on GAE in Indian experience, which is followed by panel discussion, which will be moderated by Dr. Murthy, and we will take the Q&As at that time.
Okay, hello, good morning everyone. So we've had a few talks on the technique of GAE, and Rosil has talked about the results of GAE, how it's proven to be effective in the Western studies. So I'm going to present how GAE fares in our Indian population. So they already talked about the burden of knee osteoarthritis, which is increasing as the longevity of patients increases even in India. So nearly 50% of people in the older population have some sort of knee pain, osteoarthritis, and the prevalence is increasing as we go along due to the increase in obesity. So the clinical challenge is normally when patients start with knee pain, they start with physiotherapy, conservative measures, NSAIDs, and then steroid injections, and then finally it's TKA. But there is a huge group of people who are exhausted their conservative therapy, but they're still suffering from a lot of pain, but they're either not yet ready for having a knee replacement, or they are not willing for a knee replacement. So this group of population have a significant